progress. Thanks for joining us through this suboptimal weather. Um, and I'm just excited, though, that you're all here for this really critical conversation about the intersection between women's economic security and reproductive rights. With Donald Trump and Mike Pence in the White House and anti-choice Republicans leading Congress, women's health are more vulnerable. Women's health is more vulnerable than it's ever been. We are facing truly an all-out assault. In fact, one of President Trump's very first executive orders was to reinstate and expand the global gag rule, withdrawing U.S. support from organizations that provide care to millions of vulnerable women around the world. Days later, he chose a Supreme Court nominee who has repeatedly sided against workers' rights and women's access to contraception. And the latest attack came last week when House Speaker Paul Ryan introduced the GOP's plan to repeal and kind of replace the Affordable Care Act. Unfortunately, it really is no replacement at all. It leaves 52 million people uninsured by 2026. 52 million people. 24 million more than would be uninsured otherwise, and is a all-out assault on Planned Parenthood, leaving many women without access to critical health services, especially in poor and rural areas. Put simply, lawmaking doesn't get much more callous and irresponsible than what we've seen just in the last few weeks. What Republican leaders fail to understand is that women don't live their lives in silos. Their concerns about access to birth control are not separate from their concerns about minimum wage or economic security. Their ability to make choices about their own bodies and their own autonomy directly affect their careers, their pocketbooks, their future, and their families' futures. Too often, these connections between women's health and economic security are overlooked or dismissed. That's why CAP's women's team has been working hand in hand with our economic team to produce today's critical report, The Pillars of Equity, A Vision for Economic Security and Reproductive Justice, which lays out a comprehensive policy agenda to meet the intersectional needs of working women. We're also thrilled to be joined by a remarkable panel of experts on these issues. Lisa Cook, an associate professor of economics and international relations at Michigan State University. Angela Ferral-Zabala, as the director of strategic partnerships at Planned Parenthood Federation of America. Sylvia Henriquez, the co-director of All Above All. Monica Simpson, the executive director of Sister Song Women of Color Reproductive Justice Collective. And Loretta Ross, the former national coordinator and co-founder of Sister Song. We're excited to hear their insights on such important issues that impact millions of women and families across the country. So thanks again for coming. We hope you pick up a copy of the report. And without further ado, I'll turn it over to our moderator and one of the authors of today's report, CAP Senior Policy Analyst Heidi Williamson.
Good morning. Thank you all for coming to today's event. This is a stellar panel. I'm so excited to have all these amazing leaders in the field talk about an issue that is near and dear to my heart, economic justice and reproductive justice. I'm going to briefly give you a little more details about their bios, but we're going to jump right into the conversation and then move on to Q&A. As Nira said, Loretta is the co-founder of Sister Song Women of Color Reproductive Justice Collaborative, but she also is one of the women who coined the phrase reproductive justice, and I'm sure she'll tell us a little bit later about where that term came from. She's appeared on CNN and the New York Times, Time Magazine, Los Angeles Times, and USA Today on women's issues, hate groups, and human rights. Dr. Lisa Cook teaches at both James Madison College and in the Department of Economics at Michigan State University. After she received a BA from Spelman, yay, she was a Marshall Scholar at Oxford University, where she obtained a BA in philosophy, politics, and economics. She received a PhD in economics from the University of California, Berkeley, and was a postdoctoral fellow and visiting assistant professor at the Kennedy School of Government and deputy director for Africa Research at the Center for International Development at Harvard University from 1999 to 2001. She is the author of a number of published articles, books, book chapters, and working papers, and has edited and contributed to the Harvard World Economic Global Forum and Africa Competitiveness Reports. Her research and training have been supported by grants from the National Science Foundation, the National Bureau of Economic Research, and the Economic History Association. With fellow economist and co-author Jeffrey Sachs, she has advised the governments of Rwanda and Nigeria. Monica Simpson, who is to the right of Loretta Ross, is a queer, Black, North Carolina native and has organized extensively against human rights abuse, the prison industrial complex, racism, and systematic violence against Southern Black women and LGBTQ people in the U.S. A proud graduate of the historically Black Johnson C. Smith University, she earned a bachelor's in communications and organized for LGBTQ rights on and off campus. Then she became the operations director and first person of color at the Charlotte Lesbian and Gay Community Center. Then she trained Black youth in activism, philanthropy, and fundraising at the Ijama Coordinator for Grassroots Leadership. Monica is nationally sought after as a facilitator, speaker, and organizer, constantly called upon to travel the country for appearances. She's the only woman among the 4 founders of Charlotte, North Carolina Black Gay Pride Celebration, the first in the Bible Belt, which received national awards from the National Black Justice Coalition and the Human Rights Coalition for its incredible launch with 7,000 participants. Sylvia Enriquez is the co-director of the All Above All campaign, a multi-year effort with the Public Education Campaign, a federal agenda, state advocacy efforts, and a cross-movement commitment to building a stronger base in support of abortion coverage. Prior to assuming the role of the full-time co-director of All Above All, she was a principal at Conway Strategic, where she worked with numerous clients on a variety of reproductive justice issues. Previously, Sylvia led the National Latina Institute for Reproductive Health for 8 years as its executive director. Under her leadership, National Latina developed a national policy agenda, a successful organizing and leadership training model, built state and national reproductive justice coalitions, and elevated National Latina to be a leading organization working to advance the reproductive health and rights of Latinas. And finally, we have Ms. Angela Farrell Zabala. She is the Director of Strategic Partnerships at Planned Parenthood Federation of America. Before this, she was the Director of African American Leadership and Engagement. She has been a board member with Sister Song and Youth Pride Alliance, and she received her bachelor's degree at Townsend University. Welcome, all of you. So we're going to jump right into the meat of this thing. I'm going to start with you, Monica, because I want you to tell people a little bit about Sister Song and why it's so critical that reproductive justice, it's critical for women in the U.S. to have both reproductive justice and economic justice.
For sure. Thank you again for letting me be a part of this amazing panel of folks I have so much respect for and love. So what's interesting about this time that we're in right now, we're looking at the news and we're seeing all the headlines. There's a new one every day. But we're in the midst of this huge ACA fight, right? And it took me back to why Black women came together in 1994 to create this movement called reproductive justice and to name it as that, right? So what's interesting is that, again, we're looking, it almost feels like we are, going back in time, right? In 1994, we were in the midst of another fight for healthcare reform under the Clinton administration. Here we are again with this new administration. And so the roots of reproductive justice is definitely in this fight for healthcare reform. But 20 years ago, and almost a little over 20 years ago now, Black women came together to name this movement called Reproductive Justice. And in 1997, 20 years this year, Sister Song was founded by women of color-led organizations all across the country who understood that their collective power coming together was going to help them actually achieve reproductive justice, which is really about expanding the analysis of reproductive health and rights and really centering the most marginalized communities and doing that from an intersectional analysis and rooting that work in human rights. And so when I think about where we are in this day and time, we are so much in the need of an intersectional analysis. I know that we're hearing that all across movements, that we have to do this work from an intersectional place, and that is what reproductive justice has been rooted in. We understood these women coming together, understanding that it wasn't just about securing the right to not have children, but it was also to have the children that we wanted and to parent those children in healthy and safe environments. And this movement has definitely evolved over its almost now 2 decades of life to also understand the importance of bodily autonomy, right, which allows those folks who may not want to have children, or those folks who are queer, those folks who are cisgender, trans, whatever it may be, that they have the ability to see themselves in this movement's work, because it is really about fighting for the human right for us to be able to self-determine the type of life that we want. So when I think about, me coming into this movement's work, and coming in under the leadership of folks like Loretta Ross and so many awesome women of color who were doing this work around this country, it was really important for me to name why me, as a queer woman from the South, should do this work. I grew up in this very small rural town in North Carolina, and I saw how difficult it was for so many of the women in my own family and so many of the women in my community to actually live in the ways that they wanted to support their families, right? We didn't, in Wingate, North Carolina, there wasn't a lot of jobs that were available at all, right? There were a few plants, there were a few things that folks could do, but if you didn't have access to transportation, it was very difficult for you to be able to find the work that you needed to be able to support your families. And so I was able to see at a very young age how this work of our reproductive lives, us being able to provide for our families, definitely intersected with economics, right, or the lack thereof in this community that I grew up in. And that is what this movement for reproductive justice helps to illuminate in the work that we do with women of color all around the country. Sister Song is now taking a very deep investment in Southern movement building and being an active part of Southern movement building, because we know that we're a strategically Southern-based national organization, right? And we know that in the South, that's where so many of the fights are we have so many attacks. We're under attack all the time. And so this is where we are able to see all of these intersections come together right there in that region. So we do a lot of work, not only helping to amplify these issues to a national level, but to do that base building and advocacy work necessary to have a strong region for folks to be able to organize within their own communities and to be able to create the lives that they want. We also understand that this is a time where there's a need for a cultural shift, right? The way that we talk about this work, the way that we engage people in this work. So as a national collective, and we are so deeply rooted in advocacy work and making sure that folks are able to really speak for themselves, right? But it's what is, in the DNA of Sister Song. It's about amplifying the voices of women of color in this country and indigenous women. And so in order to do that, we want to make sure our communities have the tools to be able to do that. So how do we use different ways, whether it's art, whether it is, whatever it may take for folks, storytelling, right, to help folks really be able to understand the issues and connect them to their lives and how they live their lives. So what I love about this movement is that we've never done this movement from a single issue lens. We've always done this work from an intersectional perspective because we understand that we are not single issue beings, right? We have very, very rich, diverse lives, and we have to be able to take account of that as we do this work. So I'm glad that I'm able to kind of root this conversation in the history of this movement and the history of Sister Song, but it's worked for now 20 years to make sure that women of color are centered, the most marginalized communities are centered, and that this intersectional perspective is one that we take into our work because we have to if we want to be able to make sure that we're moving the work in a way that gets our communities what they need.
Wonderful, thank you. Sylvia, tell us a little bit about how ensuring that abortion services are covered by both public and private insurance policies is a matter of reproductive justice and economic security.
Great, and thank you for having me here today. It's really a pleasure to see so many people here and to be in this wonderful institution. So I think I'll start a little bit also talking about the framing and the narrative and the work that women of color have been doing for the past, we could go back as far as 1994, and we can also go back as far as 2010 when we did get ACA. And the one issue, the one service that was left out was abortion at that moment. And women of color were the ones that came around a table and said, that's not okay. And organizations felt like, well, but we got something. Let's keep going. There's no need to distract. We need to keep going. And the perspective, as it always is, of women of color, it's we actually have a bigger vision. We need to actually see the entirety of women's health covered and secured for us to feel like we have self-determination and that we can have economic security. So fast forward, here we are under a very volatile and frightening political climate. And now we have the opportunity to reimagine what it would be like to have a proactive vision that actually encompasses every single aspect of our lives as women of color. Absolutely. So abortion is one key issue for us, but it's also about being able to secure, have economic security for our families that we currently have. Many of us are moms, parents, parenting. Many of us are immigrants. My parents are immigrants. They came to this country for economic opportunities. And many of us have many different identities that we straddle. And so for us to silo out different issues because people believe in political expediency is just not okay for us anymore. We've made that mistake in the past, and here we are. So I think from the perspective of the campaign that I co-direct, we are a campaign that is supported, fueled, and energized by a coalition of national and state reproductive health rights and justice organizations, all of whom have committed to repealing the Hyde Amendment, and all of whom have committed to stand by this particular issue. But we know it's a vehicle. It's a vehicle for self-determination, for the well-being of our families. And in this political moment, it's time for us to actually start thinking about how we weave these issues together. And I know policy is not that simple. However, I think we can reimagine policy given the kind of policies we're seeing today. I think we can get creative. It's time to think bigger. And on the other hand, policy is only one vehicle. We have an organizing commitment as well to make sure that we're building momentum with our communities around the country. So when it comes to economic justice and reproductive justice and abortion specifically, and at the intersection where all above all is organizing, we are working side by side with economic justice organizations like Jobs with Justice and ROC to ensure that the women at the center there, low-income working women who are restaurant workers in many instances and are barely making ends meet, have reproductive health security and can actually make a living wage. We are okay saying, you know what, today we're going to be out there for Fight for 15 and we are going to put our abortion banner behind us. And tomorrow we're going to be out there talking about abortion. Because we need to be able to do that for each other if we're actually going to see a progressive vision that encompasses everybody. So it may start with organizing, and it also may push up a different federal agenda for us as progressives and women of color, people of color. So those are two examples, in terms of both reimagining policy and what it would look like, not forgetting that women of color stood back in 2010 and said, no, do not leave abortion aside. And we have built a coalition since then for this particular issue. And here we are, now everything is dismantling. So we cannot divide and conquer. And then organizing, we can't forget about organizing, especially today. And organizing at the intersections is actually what fuels people and what brings people together, and it energizes a whole new group of constituents.
So Loretta, Talk to us about reproductive justice beyond sort of the policies that we have historically focused on that impede a woman's right to choose. Because most people think about, when you say reproductive health, most people think about abortion, but there are like so many other aspects to it, right? Maternal health, OBGYN care, STI treatment, sex education. But you have written a book about reproductive justice beyond the biology, about laws that actually seemingly have nothing to do with how women or how people make choices about reproduction, but actually are just as impactful as things like the Hyde Amendment. And for those of you who haven't looked on our website, Loretta wrote a column for Race and Beyond called Reproductive Justice Beyond Biology. I strongly encourage you to pick it up. It's a great piece. Talk to us about reproduction beyond biology.
Well, actually, I'm going to answer your question and go and piggyback on what Sylvia said, because I came into this movement through a biological means. I was sterilized when I was 23 up at George Washington Hospital Center. And so that got my attention when a doctor decided that I shouldn't have any more babies at 23. And so I've come full circle, and that's why I do this work. But I also want to piggyback on what Sylvia said, because I was here in the 1980s on the staff of NOW when we fought the Family Medical and Leave Act. And they said then, oh, we'll go back and fix it and include paid leave, even though it excluded so many women. So I've never been a great believer in that go back and fix strategy, because it never works out. You ask for everything you need, undivided rights. Don't let them do that. And so we have so many examples from a Washington-centered policy perspective that simply just doesn't work in the streets. So, and in women's lives. And so I wanted to just bring that history into the conversation, because that is an economic and reproductive justice issue, the FMLA, and we can't even begin to get that into the conversation yet, fixing that. But I am really concerned about the issues beyond biology, abortion, sterilization, birth control, those kinds of things, because we too often so center on those issues, we forget how non-biological issues affect women's childbearing and reproductive decision making. And particularly those of us who grew up in Washington, D.C. and watched the gentrification of Adams Morgan and Capitol Hill and now 14th and U, we know that we weren't able to make the decisions about how to have kids because we didn't have quality schools, we couldn't have affordable housing, public transportation getting deconstructed, on and on and on. These are issues that impact whether or not a person decides to become a parent. You know, do you have violence on the way to school when you're sending your child outside of the door? So reproductive justice invites us to have conversation about all of these issues. It is a capacious framework. It does include everything. It's very universalist in that way, because every human being has the same human rights. But we use intersectionality to determine what do we need to pay attention to so that parents can send their children safely to school or afford health care or have a clean environment and all of those things. And so RJ invites you to look at both biological and non-biological issues. And I want to close by just bringing my story and the comments by that guy from Iowa together. I'm sorry. It's so hard to name these people because I feel like I'm giving them air. But when Steve King said recently that we can't build a nation off of other people's babies, I'm like, excuse me, that's exactly what you did. You built a nation off of black women's babies.
Absolutely.
How dare you forget that white wealth was built on genocide of Native American people and the enslavement of Africans. Right. I mean, they not only use alternative facts. They use alternative history and expect us to forget it as if we're suddenly drugged by, I guess, there's something in water. And I'll just close.
Microwave.
It's the
It's your
microwave. It's
microwave.
all of us using microwaves and making
might
us
be
dumb,
something in the
right?
water, though.
As well as being able to spy on everybody else. And I'll just close by saying that I hear the Washington press corps talk about Kellyanne being enamored with alternative facts. Well, frankly, from the perspective of an African American, America is an alternative fact. And it's always been like this, the struggle against white supremacy. What's different now is that a whole lot more white folks are woke up to the struggle against white supremacy.
Wow.
Because they actually thought that his racism, his gender, misogynistic, homophobic, all that stuff should have kept him out of office. And you just got woke up to the reality that many people of color have lived all our lives.
Absolutely.
What do you think about the SCOTUS pick? As we, I think his hearings have yet to begin, but the Supreme Court plays a critical role in maintaining the rights that we have.
Well, I actually joined the National Council of Negro Women, who in 1973 pointed out the precariousness of the Roe v. Wade decision. And I believe that if we put all of our hopes in a Supreme Court balance that we have so little control over, women are going to die.
Yeah.
It's just going to always be that way. And so, yes, I'm going to join the fight to keep, well, we're going to replace a conservative with another conservative, but there is the risk of what happens to RBG and, what will the next appointment he has a chance to make actually do to the legalization of abortion. But I've never put a lot of emphasis on whether or not the Supreme Court sees my human rights as legal. Because we have a tortured relationship with that definition from the Supreme Court, starting with Brown, Dred Scott, Brown v. Education, et cetera, et cetera. So I'm a bit more hopeful that what we'll do is actually organize at the local level in states.
Right.
We will do everything necessary to make sure that women have access to the health care that they need, regardless of what the law says. Because just because the law says we don't have human rights, I don't see any reason for us to accept the decrees of the Supreme Court as ruling whether or not we should fight for our human rights.
Absolutely.
Dr. Cook, one of the audiences that we hope to attract with this paper are economists, those who help politicians shape budgets and make recommendations that see investing in women as part of the solution. Talk to us about how economists think about this issue. Is it a black and white case of the more you invest in birth control, the less you save government money? Or is it more complicated when you're looking at labor markets and the role women play versus the role men play? Can you shed some light on that?
Sure. So I really appreciate the opportunity to be on this panel today, and I really appreciate you folks who live along I-95 inviting us who are out in the hinterland at Michigan State, for example. I also would like to preface my remarks by saying that most of what I'll be talking about will be from my experience at the White House when I was at the Council of Economic Advisors. So the way economists look at mobility and maximizing utility and maximizing profit assumes that we have free labor markets, that we have mobile capital, mobile people, and reproductive rights are a part of that. Now, many economists aren't comfortable dealing with this issue. We're predominantly men, and most of us, if you all saw that video of the the BBC expert whose children burst in on him when he was talking about North Korea. That's most men in economics, like hiding the children. Never a conversation. So you don't even know if they have children. You don't know that they're married.
Yeah.
Right? So they're not going to put reproductive rights and their utility functions and their profit maximization calculations. So I think it is really important to find the research. Often the research that is most important for this conversation will not be in the top economic journals.
Right.
We have to stop being lazy. A lot of what went into misgauging, for example, sort of huge failures of data and of analysis, say the polling from the last election, is because people were paying to everybody who was published in the top journals. Is that a meritorious process all the time?
Right.
It is not. It is not. So we have to dig a lot more deeply, and a lot of women are missing in those top journals. So I think that first we have to look to make sure that we're using the right authors, we're using the right data, we're using the right models, and we're thinking broadly about maximization of utility and firm maximization. So the first thing that economists, I think, want to hear would be about data and about success stories. So Google, in extending its family leave policy, I think by 2 more weeks or 4 more weeks, increased its labor force participation rate by 50%. It diminished its attrition rate for women by 50%. Those kinds of data capture the attention of lawmakers and of economists. In the work that I do on patent teams, one thing that we notice is that if you include more women, according to our calculations, you would have 0.64 to 3.3% more in GDP per capita. If you just included women more on patent teams, that's all. That is all. Now, for an advanced economy, one that is mature like ours, we should really expect 1 to 2% growth per year, GDP growth per year. So 0.64 to 3.3% is huge. And I don't think there are many other things that would get us to, say, 4% growth that many are talking about today. So putting the data front and center, I think, would be central for lawmakers and for economists. If I'll give one more example, if I'm allowed to give one more example, international comparisons, I think, are valuable. In your report, you talk about our policy with respect to paid leave, the lack of paid leave in comparison to other developed economies. I mean, this is shameful. Another shameful statistic, and I think it's equally, if not more shameful, is that the maternal mortality rate is putting us on par with Sri Lanka, Kazakhstan, and countries like that. That is outrageous that the number of deaths per live birth, 100,000 live births, would be 28 compared to a place like Sri Lanka. That's outrageous. So when we're making these arguments to lawmakers who see themselves as part of a representative democracy and who know that we're competing with other countries, we can't have data like this. It just makes no sense. Okay, so those are the data. There's one more thing that I'd like to mention in this environment in terms of making defensible arguments. I think that we might have to leave behind, well, not leave behind entirely. We might need to pivot to the private sector as allies because they're thinking more progressively about some of these issues than state legislatures are and the federal government as well. So this whole battle in North Carolina with respect to the bathroom bill, So who was, and this is true in a number of different places, so in California and Texas, the private sector is the one saying, we are about to lose some money. So, you know how to make lawmakers and economists cry. You're going to lose some money. You're going to lose some money. So that's why I don't start my research with diversity and inclusion. 'Cause that is the argument, and that's why people like, or firms like Intel invite me to talk about these data, because it is an argument about diversity and inclusion. But I start with, you're losing a lot of money. You're foregoing 0.64 to 3.3% economic growth. And then we'll talk about diversity, but they're the ones who are being forward-looking about this, especially, now this is not altruistic, right? In terms of firms increasing the minimum wage on their own, or making parental leave more generous. They're not doing that for altruistic reasons. The labor market is getting tight. They are competing for talent. And the Fed is meeting today to figure out what we're going to do about a labor market that is becoming that competitive. But they understand that we're in competition with the rest of the world, and some of their policies are indeed progressive. But we often don't have a conversation with the private sector in this way. But I think because I used to work with Sheryl Sandberg at the Treasury Department, we're good friends. And I think her perspective of government and how it can be useful has permeated Silicon Valley. But they don't have, most other companies don't have that kind of connection to Washington that she does. So she knows how to find these policies and sort of put them forward in Silicon Valley, but others don't. So I think this is a ripe time to put forward some of these policies, and they're the ones who would benefit from them. So if you talk about productivity, if you talk about maximizing productivity, maximizing profit, then you have an audience. And for a number of these, they can be carved out into things they like to hear.
But is there a danger in possibly making the argument, we want women to be healthy just so they can be better workers?
And work harder.
Well, if they're not going to listen to another argument, then make that one. Oh, seriously. I come from 5 generations of Baptist ministers. I'd like to start with the moral argument. I'd like to start with, we are people, right? I'd like to not to have to respond to a lawmaker who says, why should I pay for prenatal care? So this person doesn't see women as people. You know, I wanted to find, where's Nira? Is Nira here? So I wanted to find somebody active on Twitter, just to say, well, I don't want to pay for your Viagra.
Right.
You know, if you don't want to pay for my prenatal care, okay, so we're all paying for things we don't want to pay for. So I'm saying that if that's the argument you have to make, then that's, you know, if that's the one that's got to win, you have to put your abortion rights sign behind you one day and march with other folks the next, and then pick it up again the next day. But you have to be focused for the audience you're talking to. And if they're friends today and not friends tomorrow, you can live with that, but as long as you get past what you want to get past. And sometimes the private sector can be a really great ally. And they come up with some crazy things. So freeze your eggs so that you can postpone childbearing, right? You know, so it's not crazy from a narrow perspective, but it is, you know, postpone childbearing so that you can be more productive in my company right now. But what about just making the company more friendly to having children right now, right? So I understand the skepticism, but I think you can make the argument in a narrow way and then pick up with the rest of it later.
All right. Angela.
Hello, Heidi.
Hi. As we watch this sort of repeal and replace conversation happen with the ACA, one of the issues that is front and center is the defunding of Planned Parenthood. So let's hear from the horse's mouth. Can you talk to us about like your funding streams and what does it take to make Planned Parenthood move forward, and who benefits from the clinics that are on the ground? Particularly, I have a special place in my heart for rural communities, people who are living in these deserts where there's limited to no care at all. how does Planned Parenthood serve those communities?
Thank you so much. And I'm not quite a horse, but I'm kidding. The horse's mouth. First of all, yes, thank you. Planned Parenthood is on this reconciliation bill with the Affordable Care Act and the repeal that has gone through the markup process in the House and is going to, we suppose, will be moving to a floor vote very soon. We're looking at next week potentially. It's a real misnomer to say defund Planned Parenthood because there is no budget line in the federal government that has a budget line for Planned Parenthood. There is no blank check that we're given. Like any other provider, hospital, we get refunded for services. And a lot of the services are the patients that we provide service to have Medicaid. And so make no mistake, this is a dismantling and a messing with Medicaid benefits. And so that is what is going on with defund. But, of course, the narrative makes it seem as though a check is coming to Planned Parenthood. When you talk about who we are, many of my esteemed colleagues here on the stage mentioned the different communities. We're talking about communities of color. We're talking about rural communities. We're talking about young people, and the list goes on, LGBT, particularly looking at trans communities. We have many of our health centers that provide services where folks can't get this kind of level of service and compassion at other healthcare providers. So you're looking at the heart of your community here. You're looking at working mothers, as we're talking about. We know that this, when you bar or put obstacles in a path for folks to be able to access healthcare, which reproductive healthcare is part of basic healthcare, including abortion services, then you are actually limiting their economic opportunity. And so we are, doing all that we can to not only push back this terrible, nasty repeal when we talk about ACA, but to ensure that we can continue to provide the service needed to our patients. When we talk about our patients, I have a couple stats here. Well, let me tell you a little bit about our funding stream since you asked that question. So outside of getting Medicaid reimbursements, which is a combination of state and federal funds, we also receive money from Title X. Patients use private insurance or pay out of pocket, and donations, our government grants. So those are the kind of 4 streams of money coming into Planned Parenthood, to be clear. As far as our patients are concerned, just lifting up, when we talk about African American and Latino in particular, I don't have a very expansive list with every potential demographic here, but I'll start here, is that nearly a quarter of our patients identify as Latino, Latina, Latinx. That's about 575,000 folks. And among those non-elderly Americans that access Medicaid, 31% are Latino. So you can imagine when you tamper with Medicaid, this impacts a large portion of our patient base. Out of that, 370,000 identify as African American or Black, and among non-elderly Americans that access Medicaid in that group, 19% are Black. Planned Parenthood services, abortion care, we have birth control services, sex education, and information, which is a critical piece to this also of the puzzle. We serve an estimated 1 in 5 women that will visit us, in their lifetime. So this has a huge impact on our community, the success of our community, the agency of women being able to, 1, select and choose where they want to get their health care, number 1. Number 2, being able to have access to the information and the services that allow them to plan or decide not to have a family is critical when we talk about economic security.
Thank you. Monica, can you talk a little bit more about what the ACA meant for women of color?
I apologize. I don't know what's going on with this here cough, but it wants to take over my life. I won't let it. I'm beating it. For sure. So like I started off my comments before, like whenever these women came together to name this movement that we now call reproductive justice, it was in the midst of this healthcare reform fight at that time in '94, and now we're here at it again. And I think that what rang true then still rings true now, right? The ACA for women of color in particular is absolutely crucial. It's imperative, for our communities so that we are able to live the lives that we want to and to support our families in the ways that we need to. What's also really important for the ACA is that it really did, expand, access. And we do know that there are places in which where there were some needs for more expansion, right? Because I live in a southern state where we didn't have Medicaid expansion. So we can't, have this conversation around the ACA and not talk about ways in which even the ACA still, did not provide all that we needed, but it was a huge step in making sure that our communities were able to have access to what they need. And I do think it's about family planning. It's about having people know that they have what they need to be able to plan their families and plan their futures and create the destinies that they want for themselves, right? So it's absolutely imperative, and to see that this is something that is up for debate and it's something that we're having to come back around to is like, it makes me upset, makes me super mad, but yeah, that's what it really, really means for our community.
And can you talk just a little bit about your Black Mamas
Black
project?
Mamas Matter, sure.
Black Mamas Matter.
So I was going back on to my sister here when she was bringing in the stats around maternal mortality. So in doing our Southern movement building work that we do with Sister Song, one of the things that we wanted to expand to was to talk about healthcare in general, and to talk about those things that were coming up under healthcare that we needed to pay more attention to. And so the rising rates of maternal mortality in this country were absolutely shocking for us. So in the state of Georgia, which is one of the southern states with the highest maternal mortality rates, Black women were dying at a rate 4 times higher than white women in childbirth, right? So what was really important for us, because we saw that, Black women, it didn't matter how much money they made. It did not matter their what their education level was. What we saw and what we were able to do in our reporting with the Center for Reproductive Rights was to see that a lot of what was happening in these states was that the underlying issue was racism, and it was, the lack of access that folks had. And so we created the Black Mamas Matter Alliance, which is a national group of women who are working together to address this issue head on from a reproductive justice perspective.
Wonderful, wonderful. Sylvia, you talked earlier about this is the prime time to come up with a proactive agenda. What's on your wish list?
Yes.
I was afraid you would ask me. So we, All Above All has been able to introduce a proactive bill. We introduced it in 2015, and we're going to continue to keep pushing, which is the Each Woman Act, and it is asking the government to cover abortion services. In a nutshell, Kelsey, my colleague, could probably go into greater detail and much more eloquently than I can about this. But so I think for me that's certainly our proactive federal bill. But we are also at All Above All thinking about, well, what does proactive in this climate mean? And that's what we also want to re-envision. So it's a piece of paper, a policy that we introduce, but it's also going to take a lot of creativity to think about what we can do on the state level. It is a very dismal climate on the state level as well, but yet let's figure out how do we keep that momentum of proactive work. I mean, we've heard some statistics that in 2016, the field of reproductive health and rights and justice introduced an unprecedented number of proactive bills across the states, right? So we can't let that die down. We need to start thinking about it. So for me, it's actually a lot of cross-movement building work with economic justice. I mean, I think we are thinking through...
Economist.
Right. I've learned that too today.
Typically don't like us, but it can be helpful sometimes.
Sometimes we do not use your statistics. It's true. But I will say that it is thinking creatively with our economic justice sisters and colleagues and saying, well, what's on the horizon? So, for example, the labor secretary nomination, Butzer, having him not be labor secretary was a huge win for labor, and it was a huge win for reproductive justice and reproductive rights groups too. So those are the kinds of proactive kind of visioning things that we want to start thinking about, and cross movement and movement building is at the core of that. So I think it's let's figure it out together.
Okay. Loretta, as the human rights expert on the panel, what does it take for us to be able to bring human rights home?
Well, first of all, we have to learn what human rights are. You can't fight for rights you don't know you have. And so we need human rights education in all of our social justice movements and all of our educational ventures, because we're entitled to a set of rights that First Lady Eleanor Roosevelt wrote about. You know, when we were first talking about, you know, developing programs, a social welfare contract, and we've just forgotten how important people understanding that they matter, that their human rights matter. And our human rights are not a flavor of the day, but are something that are inalienable to us.
For intersectionality.
For intersectionality, right. Well, intersectionality is a new buzzword. But, you know, I'm one of those people that says when you're announced to me that you're intersectional, that's kind of like announcing that you're a human being. I kind of take that for granted. You know? We all have multiple identities. We all have things we need attention paid to so that we can get our human rights protected, whether you're from a two-parent family or a minimum wage job or, you know, cisgendered. I mean, I'm just exhausted by people thinking that they're the only ones with these identities. But that's a whole nother speech. But about human rights, I love the fact that we're the women's rights wing of the human rights movement, working with the economic justice wing of the human rights movement, working with the racial justice wing and the immigrant rights wing and the queer rights wing of this shared framework. And I'll just say, in 1968, Dr. Martin Luther King, in his last Sunday sermon, called on us to build a human rights movement 4 days before he was assassinated, March 31st, 1968. And when I heard that for the first time in the 1990s, I said to myself, everybody told me he had a dream. Nobody told me he had a plan. And we're supposed to be building a human rights movement that holds our country accountable for its violation of people's human rights. And so that's why it's so important to me.
And before I forget, tell everyone how you came up with the term reproductive justice.
Oh, yeah. Well, first of all, we were frustrated that abortion was isolated from all the other social justice issues that mattered in people's lives. And so we spliced together social justice with reproductive rights and created reproductive justice so that any conversation around abortion was embedded in a social justice framework. And then we learned from our sisters in the global South, actually, that they used the human rights framework to make claims that we were trying to fit pretty badly within a constitutional framework. And we said, well, why aren't we using the human rights framework? Why can't we bring human rights home to the United States? And so that's how reproductive justice got created and then populated. And once we found that we were actually talking about women's human rights and people's human rights and all of these things came together, then we felt that we were finally sufficiently grown up to join the world human rights movement. Which has really, for the last 60, 70 years, better used the framework than we've been able to do in the United States.
Dr. Cook, I know you talked about some of the successes of economic security and reproductive justice in the private sector, but can you talk a little bit about what you think the economic consequences will be if we are unable to economists are unable to make reproductive health, rights, and justice a priority? Is it job loss?
So economists are already don't make this a priority. So
Okay.
you're describing now?
Like some other consequences beyond what you mentioned earlier.
Okay. So if we don't, first of all, economics will be isolated, right? If we don't start putting into our models the factors that actually matter. So as I was saying, we depend on this fundamental assumption of self-determination, of people making choices and rational choices. And my view is that if we just give women the tools, they'll make all the rational choices and eliminate the kind of discrimination they face. They will make the right choices if we increase their pay, because 37% of low-wage workers are women, and they are the main breadwinners in families. we don't need to do more. We do need to do more than that, but there's some simple things that we can do to allow them to make the choices that would be most rational for them. So if we don't incorporate such factors, we're going to make ourselves irrelevant. If we don't incorporate this as, or acknowledge this as a barrier to labor force participation, we're going to become irrelevant. We're really going to become irrelevant with the census. So single women are growing significantly as a population in America, and we're
Voter.
the Beyonce voter, and children are living in their parents' basements. They are waiting to get married. There is less household formation. I read 3 or 4 days ago that people are having less sex as a result of, like, I didn't click on it. I didn't click on it. But a long-term trend is that there are going to be a lot more single women in the economy. We're going to be making a lot more decisions. So there are a lot of things that have to change. So if you want to make yourself irrelevant, a good way to do it is to assume that you understand all of the things that are going to be relevant for them. So reproductive health is going to be major for single women. So unless somebody's, well, I don't want to go there. I was thinking about a mass conversion, or people are forced to do something else. There are going to be a lot of single women in the economy, and I think that these models have to they have to catch up. Yeah.
Can you think of anything that reproductive health advocates could do to better partner with economists?
Again, start with the data. Now, I typically start with the shaming data. Again, like Sri Lanka, Kazakhstan. Why are we on par with them when this is a developed country, for example? But I think the other thing that we could do is to make sure that our storytelling is balanced. So in this report, there were a number of policy proposals, and I would, and I'm thinking with my White House hat on, the policy proposals that we put forward, say, before the State of the Union, and that got articulated, and then we'd have to follow up on, they needed to have data and some sort of empirical support, and not a lot, because I was there in 2011, 2012, and unemployment was still very high. I think it was as high as 9% at that time. We didn't have to have perfect data, but we needed to have some support for it. And then we needed to have a compelling story. So let's say for getting people to work. I mean, you saw the many proposals that were out there. We were always pushing ones, trying to get the president to say this in the State of the Union. But that's one thing that one needs, is just some sort of empirical evidence. Again, making sure that you're not just looking at the published papers that are in journals, because those often exclude women, they often exclude diverse views. The other thing that one needs is storytelling like they have in documentaries. So the center, the Samuel Du Bois Cook Center for Social Equity at Duke University has this documentary film project whereby it is interviewing low-wage workers across the country. I think the first project was interviewing them across North Carolina. You might know more about this than I do. But I saw some of those documentaries, and they were so moving. They were so moving. And this is the complement to the data that people often can't access easily. This woman at Burger King was talking about not being able to go and see why she was bleeding, because her manager said that if she didn't go, if she didn't stay and work, then she would lose her job. And of course, she was having an abortion, and she didn't know it. And it was that's right. She was having a miscarriage. These were some powerful stories, and these are things that economists probably can't tell well, but that are also told better with real people. And I think we have to complement the two. Sometimes you need the stories just to be able to convince people who would otherwise not be convinced. Like I said, I'd always like to start with the moral argument that we are all human beings and we are deserving of treatment as human beings. Sometimes you have to have a story. So I would suggest packaging it in such a way that marries data and evidence with compelling human stories.
Okay, did you-
I would just say something about defending the Affordable Care Act. Everyone with a pre-existing condition should be enlisted in our fight.
Absolutely.
And because I have them, and every human being that's getting health care has them. And so I'm not so sure if strategically we couldn't build a campaign and totally destroy the solidity of their base if we just made it a campaign around pre-existing conditions, because that matters across all political divisions. And that's what storytelling does.
Absolutely.
That's what storytelling does. It brings us together because, you know, we're all fundamentally humans together against a healthcare system that's more devoted to profit than people. And we could do that.
And not even devoted to profit. I would argue it's not even devoted to profit. It's just messed up.
Just messed up. So they don't even earn money well, huh?
Well, no.
Angela, last question. You talked a little bit about your clients, but what are some other partnerships that you find invaluable in your role as a strategic partnership director at Planned Parenthood?
Yeah, no, that's a good question. I heard a lot of that come out today. I think that there is, and I think, Sylvia, you may have mentioned this, there is an incredible need for us to be linking arms in this time where so many things are under attack. I think, you know, it's especially when we think about women of color that have led the way in many of these spaces. We need to be thinking, particularly as a mainstream organization, how we are fitting into kind of this ecosystem of different entities that are working on this and leading the way in many ways. How we are actually plugging in and lending whatever our expertise is that can lend to that fight, which is really important. So as the Director of Strategic Partnerships, it is really important for me to have an ear and my finger on the pulse of what is happening external to our organization. That is, you know, while we're in the middle of, you know, fighting against the repeal of ACA and our defund, we also know that there are a host of other things that are happening around immigrant communities, around LGBT communities, around our Native communities and the pipelines. There's so many things that are happening. And so I think part of my job is to make sure that we are aware of our surroundings and that we are playing a role the role that folks want us to play in helping to push on those things using our 100-year brand and whatever our capacity is to stand. So some of those examples are working kind of and sitting in coalition with many of many of the organizations just to figure out where we can fit in and push back. The Supreme Court nomination is one. Some of the other nominations to the cabinet were places that we were in partnership with folks. The global gag rule, there's lots of things that are happening, and I think that is really one of the most important things that we can be doing right now is just figuring out where we can actually partner up, use our expertise and capacity to help other fights, which actually intersect. I mean, they're not others because they're part of our patients, our communities, our staff, providers, so this is us, so we can't act as if we're in another place and there are other folks. So I think one of the things that we have to be very careful about, as we heard from the panelists today, are that a lot of these movements are being led by many of these communities that are at the center of a lot of this impact. And so it is imperative that we're having the dialogue and the conversation and really figuring out what our role is and not coming in and taking a space that we don't need to be taking.
Okay, thank you. Now it is time for Q&A. So we will begin to take questions from the audience. Okay, we're going to excuse Monica Simpson, who has to travel.
So sorry.
Planes, trains, and automobiles.
I have no control over the train, or apparently coughing. I'm sorry.
Magic, they set that up for you.
See you,
That's
Monica.
you?
That's for you and your call.
Thank you. I don't even know what's happening, but I'm gonna step up so y'all can answer questions.
Thank you, Monica, for
Thank
coming.
you.
Monica, for joining us.
I am Jill Gay with Works Association, and I met you, Loretta, in the 80s when I worked with Isabel Letelier on human rights.
Oh,
So my question is, in our current political situation where evidence is not valued, how do we move forward?
With real data.
Can I?
Well, let me do it first because
Yeah,
you're
no,
into
go ahead.
facts, and I'm not necessarily persuaded that facts matter in an alternative facts world. I mean, that's been, I think, the problem of progressives is that we think reason is a sufficiently winning strategy. And we have been proven over and over again that rational, just rationalizations and reasons and data, these are,
Rationing, yeah, it doesn't, with irrational people, it
with
doesn't
irrational
matter.
people, it doesn't move them.
Matter.
And so I'm going to actually not say that we don't believe in facts and we don't believe in evidence, but we have to stop thinking that simply presenting that evidence is enough to win. So I'm sorry, I stepped all over that evidence-based thing. What we have to use is people's passions. People actually in this country care about fairness. They care about being seen as serious human beings with serious sufferings. The thing that the administration, I'm having trouble saying the name, did so well is create the false impression that he takes their suffering seriously, when we all know he doesn't. But we don't necessarily create the impression that we take their suffering as seriously, And so I'm saying that people are going to have to learn in Washington to come back to people like us at the grassroots who know how to move populations, who've deprogrammed white supremacists, for example, and got them to understand that we can build a human rights movement together. We cannot rely on that failed strategy of evidence and facts being a winning strategy. I'm a scientist. I understand the importance of evidence, but at the same time, in this political calculus that we're dealing with, facts have not only been made irrelevant, but the fact that you're presenting them becomes a suspicious point of view to come from. I'm sorry, now you get
Well, actually, we're saying somewhat the same thing. So I have two strategies with respect to numerical evidence and evidence-based activism. One is I was sitting back waiting for the first jobs report to come out that would be under this administration. Because there is no way that somebody was going to say that the unemployment rate was still 42%, right? So then the argument is, so I started off as a philosophy and physics major, right? So I'm into logical argument. So I was waiting for that day. So on that day, I was tweeting ad nauseum about what is real data. So now you believe the BLS. You believe the Bureau of Labor Statistics. You don't believe they're making it up because the unemployment rate is low. So I just expanded the argument from there, and it was hollow. And I would argue that that was the one that ultimately had to be embraced, because then it was silly. Then it was shown for what it was. So for some data, I think we actually have an argument. And I was horrified when, during the campaign, the BLS economists were under attack, and any government economists were under attack, because they are serious. And this is, this, to me, having lived in Russia, to me, this undermines the basis for a democracy. Is independent research, independent data, and the same thing for I was waiting around for the CBO score to come out. Because I was waiting for the CBO score to come out during the Obamacare debate. And yes, I was nervous. And of course, it was worse than we expected it to be in the White House. But we embraced it. We understood that it was never going to be what we wanted. But we accepted it as an independent institution. So again, I was back on Twitter. How about that CBO score? That's interesting. So I think there's some points along which one can say this. But I agree with Loretta. I am one of the few people, one of the few economists I know who predicted the outcome of the Democratic primary in Michigan and the general election correctly. How is that? It is because I used to live in Russia and I'm used to being lied to. I'm used to data that are imperfect, either because people want them to be imperfect and want to mislead you, or because they don't have the capacity to do it correctly. I invited national pollsters to Michigan State University in January of 2016 to tell them that their data models and assumptions were wrong and that they needed to come to our campus and have a discussion about this. Actually, I invited one person whom you all know twice and heard nothing back. And what I was doing was I was using social media. So when you have social media data analytics, when you have people who aren't going to answer questions in a normal way, as they often did not when they were being polled in Georgia, where I grew up, number one, or in Russia, where there were, it was a period of transition and people were tired of answering questions or they wanted to mislead you, you needed to have something else. So I was using sort of the very sophisticated model to try to figure out what people were going to do, because they hadn't voted before. Another thing I was doing the same thing organizers do. I was counting signs. I was counting signs between East Lansing and Ann Arbor, or I call it Kentucky and Brooklyn. And I was doing it in 3 different directions. So what I'm suggesting is that it is not the economic enterprise. It is that people mistook economics for religion, and it is a science. And they admitted it not long ago, that they were so wrapped up in having the first woman president that they were blurred by their beliefs. That's not what science is. And that means that you have to pick people. That's why I'm saying that, in answer to your question before, you have to make sure you know who you're reading. Because just because it is appearing, and I think this is why, that I was emailing out of the blue from Michigan State University. If I had been at Harvard where I was before, or at Stanford where I was before, I think somebody would have picked up the phone. But because I'm on the ground and I know my students from Michigan State University, I know the state, and I understood that it was a battleground, I don't think anybody picked up the phone. So I think people have to be very careful with the data, and they have to ask questions. I tell my students, I teach an econometrics course, you need to date your data. You need to figure out what's going on there. You need to have the data's credit score. You need to, know the data's parents. These people were marrying their data. They didn't understand. They didn't understand the algorithms they were using. Right, so I would say that many people are saying, economics is already irrelevant. No, it's if you understand at a deep level what economics is and how to use economics, I think you wind up in the position I was in, and I was working very actively to make sure that some other person won, but it wasn't the case, but we have to be very careful, and we have to harness data in the right way.
Okay, all right. It seems we have run out of time.
Oh, I'm so sorry.
That's okay.
I'm so sorry.
That is
I'm so
fine.
sorry. I'm so sorry.
Thank you all for coming. On your way out, please pick up a copy of the report as well as Loretta Ross's article in the Race and Beyond column.
And her new book.
And her new
Flyer on my
book.
new
There's a
book.
flyer for her new book. The book drops this week. We hope everyone will go out and buy it, by Loretta and Ricky Solinger, both mothers of the movement. Thank you so much.